Hello everyone, welcome back. In the last session, we have talked about the current status of patient safety and factors that may affect this important issue. Implementing measures to prevent specific injuries such as falls and burns are critical aspects of nursing care. In this session, we'll focus on discussing fall prevention. This may not seem like an interesting topic, but it's important. After this session, you should be able to describe the current status of falls in hospitalized patients, describe when we should assess risk of falls, and implement proper preventive measures. More than one-third of adults aged 65 or older experience falls due to physical changes, ill health, or medications. In this group, falls is the leading cause of injury-related death. Falls can break bones and decrease self-confidence for future independent ambulation. Therefore, we should take strategies to prevent falls. Identifying patients at risk for falls reduces the number of incidents that occur in the hospital. In 2010, the Joint Commission in the United States added two required standards relating to patient safety and hospital falls. One is the hospital must assess and manage the patient's risk for falls and implement interventions to reduce falls based on the patient's assessed risk. However, when should we do the assessment? It is important to assess patients for fall risk on admission, whenever a change in physical and mental status occurs, on transfer, and before discharge. Many assessment tools to determine a patient's risk of falling are available. Most fall scale is used most commonly. Most assess for age, history of falls, cognitive status, vision, number of diseases, physical ability, medications, and clothing. For high-risk patients, we can use fall risk alerts, such as patient ID wristbands of a specific color or special alerts cards at bedside. We should identify specific fall prevention strategies and develop an individualized care plan. Now, let's list the strategies. We will talk about them one by one. First, we'll talk about orientations of patient to his or her surroundings. On admission, familiarize the patient with the work surroundings and explain the call system, especially for the confused patients. Have the patient teach back how to use the call light. Encourage the patient to use it to request assistance. The second strategy is to make sure that the patient's room meets safety requirements. Ensure the call bell and the furniture in the room are conveniently arranged. Also, the patient's personal possessions are within safe and easy reach at all times. Always keep hospital beds low and wheels locked when not providing care, so the patient can move in or out of bed easily. Keep the bed drills up as appropriate. Ask the patient and family to use the call light if he or she needs to get out of bed. Although it may seem raising the bed drills is an effective method of preventing falls, do not do this routinely. Research has shown that individuals with memory impairment, altered mobility, and other sleep disorders are prone to becoming entrapped in set rails. Patients may even become entrapped between the mattress and set rails, leading to asphyxiation. We could use protective pads between the mattress and the set rails as needed. Teach the patient to use handrails in washroom. Make sure non-skid bath mats are available in tubs and or chairs in showers. Keep the patient area uncluttered. Floor surfaces clean and dry. Clean up all spills properly. Ensure adequate lighting, especially at night. If possible, make sure the switch is within the patient's easy reach. Moreover, we should closely supervise the patients at high risk for falls. Our third strategy for patient safety is to provide assistive devices. Carefully assess the patient's ability to ambulate and transfer. Provide working assistance as required, such as cane, crutches, walkers, and wheelchair. We should also help the patient to adjust working aids according to his or her height, and teach him or her safe transfer, for example, between the bed and a chair. Next, we need to instruct the patient to wear fitted shoes and trousers. High heels, floppy slippers, and overlength trousers can make the patient stumble and fall. It is important to educate the patients about postural change. Teach the patient to rise slowly from a lying to sitting, then to standing position, and to stand still for several seconds before walking in order to prevent postural hypotension, which may increase the risk of falls. Let's move to the sixth strategy. Review the patient's medications. Review the patient's medications for side effects and interactions that may increase his or her risk of falling, such as sedatives, antihypertensives. Next, we should encourage exercise and activity as tolerated. Physical activity can go a long way toward fall prevention. Encourage the patient to take appropriate exercise and activity to maintain muscle strength, joint flexibility, and balance, such as walking, Tai Chi. The last but not least strategy is to use individualized interventions. Electronic safety monitoring devices are available to track patients' activity. For instance, an alarm mat next to the bed could alert the nurse when the patient is trying to get out. In short, we should choose proper assessment tool to assess the patient's fall risk. We should consider specific fall prevention strategies and develop an individualized care plan. Hospital environment is designed with many safety features to reduce the risk of falls. It is important that we instruct the patient and the family to make best use of these safety measures to avoid falls. These are the references. Thanks for joining us.